If you've been considering acupuncture or you have been referred for it, you might be wondering what to expect. In this short video, we're going to cover what acupuncture is, how it works, what it's used for, what to expect during a session, and potential risks as well as safety considerations. So first of all, what exactly is acupuncture? Well, acupuncture is a treatment that comes from traditional Chinese medicine. It involves inserting very fine needles into specific points of the body for therapeutic or preventative purposes. In the UK, it's used by some GP practices and pain clinics, and it's also commonly offered by physiotherapists. Now, there are two main approaches to acupuncture. Traditional acupuncture is based on the idea that an energy or life force known as qi flows through your body along channels called meridians. If this flow is blocked or disrupted, traditional practitioners believe that this can lead to illness, and acupuncture is used to help restore flow of qi and improve your health. Now, Western medical acupuncture, sometimes called dry needling, takes a slightly different approach. Here, the idea is that inserting needles into specific points stimulates sensory nerves under the skin and muscles, which can trigger the release of natural substances like endorphins, your body's own painkillers. This might help explain some of the therapeutic effects that people report. So what kinds of problems is acupuncture used for? Well, the National Institute for Health and Care Excellence, or NICE, currently recommends acupuncture in the NHS for certain conditions, including chronic pain, chronic tension-type headaches, and migraines. It is sometimes also used to treat joint and muscle pain, as well as jaw pain and symptoms of cancer or side effects of cancer treatment, as well as feeling sick after surgery or chemotherapy, prostatitis symptoms, as well as persistent hiccups, for example. Now, although it's used for many conditions, the evidence for how well acupuncture works can vary, and for many uses, it's still considered a complementary therapy. Again, this is going to vary from person to person, and each individual is going to find different benefits from acupuncture. So what can you expect if you go for acupuncture? Well, an initial session usually lasts between 20 minutes to an hour. Your practitioner will take a full history of your symptoms and assess your general health. You may also have a physical examination. Then they'll decide which acupuncture points to use and insert very fine needles into specific areas of your body. The needles may go just under the skin or a bit deeper into the muscle, depending on the condition being treated. Once in place, the needles might be left in for anything from a few minutes up to 30 minutes. Now, most people don't find the process painful. You might feel a slight tingling or dull ache when the needles go in, but this should pass quickly. If you do feel pain, let your practitioner know straight away. Now, courses of treatment usually involve several sessions, and it can take a few appointments before you begin to notice any benefits. So now let's briefly touch on safety and potential risks. So when carried out by a qualified practitioner, acupuncture is generally considered to be safe. Mild side effects are fairly common and might include slight bleeding, bruising, feeling drowsy, or lightheadedness. Serious complications like infections or punctured lungs are very rare. Now, acupuncture is generally safe during pregnancy, but some acupuncture points are avoided, so always let your practitioner know if you are pregnant. If you've got a bleeding disorder, take anticoagulants, or have a metal allergy, it's important to tell your doctor or practitioner beforehand. Now, these aren't all of the potential risks, and so it's really important to discuss them all with your own health practitioner before undergoing any treatment. Finally, acupuncture is not currently regulated in England, so if you're seeking treatment privately, it's recommended to see someone who's a regulated healthcare professional like a doctor, nurse or physiotherapist, or a registered member of an accredited acupuncture body. Thanks for watching, and for more details including how to find a qualified acupuncturist, please check the links in the description box of this video. And as always, if you've got any questions, do speak with your own healthcare provider, because this is an educational video only. Thanks for watching, and until next time, bye.